Good morning.
Hello.
Dr. Lachlan, how are you?
I'm feeling very well, thank you.
Excellent, very good to see you. So it's 72 hours after surgery today.
Yes, it is. It is.
You're upstanding already.
Well, I was standing after 24 hours and walking all over the place after 30 hours. So
excellent.
I'm
excellent.
not quite ready to play golf yet.
Yes.
Almost.
Almost there. Almost there.
Yes.
So we're starting with the pitch and putt first.
That's right.
Now, did you require much analgesia in the first 24 hours?
No. Panadol.
Right.
And something else, I'm not quite sure, but the residual pain that I've had over the first 24 hours and since then has been negligible to the extent that I don't need anything now at all.
Just wondering whether we've done the surgery. Excellent.
I can show you the scar.
All right. So you've been walking around, and during the first 24 hours, we of course gave you some precautionary calf compressors to try and develop any clots that was part of prophylaxis to try and prevent any possible complications with the DVTs, with the clots in the legs. So that went well, okay. And as you said, 30 hours you've been walking around, doing the laps around the ward,
Yep.
and now you're ready to go home.
I am, yes. I'll be packing off in an hour or so.
Right, excellent.
The main question I have is regarding the catheter.
Yes.
I understand it's going to be removed in something like 7 or 8 days from now.
Yes.
But I'm a little bit concerned as to what might happen if it starts to leak, for example, or
Yes.
What action should I take?
Yes, with the catheter, what we like to do is just to leave it in place for usually about 7 days to 10 days,
Yes.
depending on whether it's on a weekend or whether we can take it sort of safely in the period of time. Now, the reason we leave the catheter in place, of course, is because we have joined the bladder to the urethra, which is and then we've put some stitches there, so a catheter is keeping it open, and it allows it to heal around the catheter. It does cause a bit of discomfort for patients, and the main problem with looking after the catheter would be that, like you mentioned, a bit of leakage can happen. That is normal because what happens is the bladder is contracting, and what happens is there would be then a bit of urine leaking around the catheter. So do not be alarmed about that. It might be even a bit of blood sometimes, so a small amount of blood around the catheter or around the edge of the eye of the penis.
It's
so
important for me to know
yes.
in advance whether
That's right.
something like leakage is important or whether it's something that's totally
Correct.
irrelevant.
Correct. So that will happen, and I think don't be alarmed about that.
Okay.
The other thing about the catheter, I think, which is very important, that from the surgical point of view, what we need to do is we need to make sure that catheter is draining all the time.
Yep.
Okay, and so you want to make sure that every hour or every couple of hours you check that it's draining, because if there is any blockage to the catheter, we need to attend to that, and we need to attend to that very promptly, because we don't want for you to be in a position where there was no drainage, for example, for more than 2 hours, and then you have the bladder full, and what happens then, the stitches that we've applied for the anastomosis are stretched, and the stitches then can be pulled, you see. So we want to make sure that we're protecting that anastomosis and the joint that's in place. And that's what the role of the catheter would be. And if there's any problem at all, you just contact the hospital, and you contact us directly, and then we will organise for you to come straight in. We'll organise for the catheter to be flushed and make sure that it's all draining. And normally it's just about 5-10 minutes procedure, really, and you don't need to go to theatre or anything like that. It's all done in the room.
That's a fairly infrequent occurrence, though, isn't it?
It's fairly infrequent occurrence in terms of catheter getting blocked, but it still can happen from time to time. And I think as long as all the patients understand that that is a possibility and they do not delay it for too long, then any possible damage to the anastomosis, to the joint, would not happen.